All right, today's doctor is a special guest, Dr. Venkatesh Movva from the Pain and Sports Medicine Center. That's down near 61st and Yale. Welcome to the program, Dr. Movva.
Thank you very much. Nice to see you, Dave.
And it's good to see you again, doctor. And, you know, we're talking about osteoarthritis today. So what is it and kind of who's at risk for it?
Right. Well, osteoarthritis is probably the most commonest, disease that you see as people age. And there are multiple risk factors. Who is at risk? It could be some modifiable factors where some lifestyle can cause, like obesity is a big factor. Genetics is another factor. Age, we see that age. And the newer theories are just inflammation. Some there are inflammatory conditions that can cause, where the modifiable factors are basically, we can, with lifestyle modifications, we can probably alter that thing. But the other factors, we really don't know. So we just have to deal with it when you get it and what you can do with it.
So at some point, I guess when it's the joints that kind of deteriorate. Right. And so when is it time to go beyond the topical creams and maybe start thinking about surgery?
Right. Well, when do you go to the next level? See, osteoarthritis could be mild, moderate, severe. So when you're having difficulty doing your daily activities, so that means it's kind of advancing, then you go to the next level. So you have tried your creams, you have tried your steroid shots, they can help you temporarily. You've tried some biologics like Hyalgan, Synvisc. These things can help you at a longer term. But once the disease progresses, once you lose a little bit more cartilage, then you may have chronic daily pain, even with minimal activities. Then you're looking into the next type of treatments. So there are multiple options available, including physical therapy, light activity, and then you go into a regenerative stuff, which we're doing recently, kind of regenerating some of the cartilage back, and these are all newer therapies. And there are also certain cases where it's beyond the repair, so it's already end stage, so you're going into a surgical option at that point.
And I wanted to take some time briefly to talk about, because about a year ago, we did a story, you and I did a story together about stem cell options if it's not advanced to the point where you just absolutely need therapy or surgery. You can actually use stem cells from your own body to regenerate some of your tissue. That's very interesting.
Absolutely. I'm sure you're reading in news and you see it on a lot of athletes, that's how it's got popular. Yes, as I said, like if you're a severe case, it's too late. For example, if you take a knee, it's already end stage, you're definitely needing a surgery. But the majority of the people are coming to us when they're mild to moderate level of arthritis. These people are good candidates for taking your own stem cells, because stem cells have the capability of regenerating some of the cartilage and ligamentous structures in there. So basically reversing a little bit of aging in the knee and possibly avoiding a surgery. So these kind of group of people are getting a lot of benefit with these newer procedures that we're doing.
All right, well, Dr. Venkatesh Movva, thank you very much, sir.
Thank you.
Down at 61st and Yale is where you can find him.